Thank you guys for coming out tonight. I'm Lindsay Wiggins. I'm a physical therapist. I work at the Boulders location, and I was recently certified in SportsMetrics. Before we get started talking about what is SportsMetrics, a couple of things I want to point out here. When we're talking about ACL injuries, the patients or athletes that you guys are working with are the ones that have the highest incidence of ACL injuries. So our program is really focusing on those from about 15 to 25 years old, and also more females than males. However, males do get a lot out of the program too. 70% are non-contact injuries, so this is what SportsMetrics is trying to prevent, those non-contact injuries rather than contact injuries, because we have more of control over them than contact injuries. Yes, when we talk about risk factors, we're going to try to prevent the neuromuscular risk factors, so the knee joint and the muscle surrounding the knee joint and how that plays a part into the positioning of the knee during dynamic movements and sports activity. So again, there's a lot of different mechanisms for ACL injuries. One of them is this dynamic knee valgus that we find. We see this a lot of times in females, males sometimes too, when they're jumping, cutting, running, pivoting, etc. So again, SportsMetrics, this is what we're going to try to prevent, is this dynamic knee valgus that we see. So as far as injury prevention goes, we know there is a physical burden on the patient. We talked about the increased incidence of knee OA or knee osteoarthritis, but there's also an economical burden and mental burden on the patient as well. SportsMetrics was designed by Dr. Frank Noyes and his team at Cincinnati Sports Medicine and Orthopedic Center. It is a 6-week program. The athlete's going to go through it 3 times a week, possibly 2. So SportsMetrics has 5 different components. Every component will be taught at every session, and we'll go into that in just a minute. SportsMetrics has a pre-test that they will go through. Every athlete goes through this. We'll take them through a few things, but one of the neat things about the pre-test is that there is a video analysis for this. The athlete will do a jumping video analysis. We'll take them, videotape it, take it frame by frame, put it into this digitizing software, and come up with a report. So like it says, every athlete and even coach can get a report of what their athlete, how they tested out on these certain things we take them through. So SportsMetrics, again, 5 components. Every session they're going to go through a dynamic warm-up. So this is going to be functional-based activities, which gets them ready for their second component of SportsMetrics, which is the jump training. This is going to be the most structured part of the entire program. It's 3 phases. So phase 1 is taught for 2 weeks, phase 2 for another 2 weeks, and then the last phase for the final 2 weeks of the program. We'll go from simple jumps to more multi-directional or side-to-side jumps, and then into the plyometric piece of it, which emphasizes a quick turnover or more of those sport-like motions. So strength, you can go to the next one, and speed and agility. This here is going to be the part of the program which has most flexibility and variability here. We'll take this part, we'll find what the athlete, their impairments or kind of deficits we see during their testing, and create that program specific to them or kind of to the team. Now here, if we are training a team, this is where we can use athletic trainers or strength and conditioning coaches to help out and to implement this part of the program. So the last part of it is the flexibility component of it, and this is going to be part of their cool down, more of the stretching aspect of the program. So now after the SportsMetrics is complete, we'll take them through again the same testing that we did initially. They'll go through their video analysis, jump again, and hopefully we'll see, like you see on the screen here, a difference between their pre-test and then their post-test. So the difference between kind of their knee and ankle, hip angles there. So coming out of that dynamic valgus that we talked about earlier. So when we talk about SportsMetrics, it sounds like a great program, but really, is it effective? And Dr. Frank Noyes and his team, again, has done a lot of research on this and shown that, yes, it is effective in improving risk factors Those female athletes that went through it, they saw 2/3 of them had increased separation of the knee compared to the ankle and the hip distance there, again improving that dynamic knee valgus that we found to be a risk factor for ACL tears. So not only is this a fantastic injury prevention program, but it's also great for sports performance and enhancement, and that's also what coaches really like to hear, or athletic directors or trainers, because not only do we want to prevent injuries, they want their athletes to be the fastest, the strongest, and whatnot. So you can see a list of the other things that SportsMetrics has seen to improve there. And another study was done that looked at all of the programs, all of the prevention programs, and again, SportsMetrics was found to be the most effective program in regards to athletic performance and enhancement. So do results last? Like we said, this is going to be an in-season, or preseason training program. So if your athletes do it, 2 months out, 3, 4, maybe even up to 8, are they going to still maintain the same results that they had right after now when they're in season? And another study was done that shows they retain those benefits up to 1 year. So it is a program that we would hope athletes would go through yearly, but they will maintain preseason to in-season the same benefits. The WIP program, this is an injury prevention program that is an in-season option for coaches. So we come out and teach them the WIP program. It's 20 exercises, takes the same components of SportsMetrics, condenses it. It's great for a warm-up leading into practice activities. You guys can take that and you can implement it as their warm-up during their in-season sport. So again, just a little recap of what we went over. One other thing I do want to mention here under the when section, we said it's preseason training, but it can also be, in the unfortunate instance that your athlete does have an ACL tear, it can be used as part of their rehab. So when they are appropriate, we can take the athlete through the SportsMetrics training to hopefully prevent future injuries, like we said, injuries on the opposite side as well.
Thank you.
Awesome.